Hello, good evening, and how are you doing? Welcome to another session of Ask the Doctors. The time is 8 p.m. here in Nigeria. How are you doing? Happy Sunday to you. Welcome to the last Sunday, actually, the last Sunday of the month of June 2025. Now, on today's program, we'll be talking about peptic ulcer disease, the facts, the lies, and then we'll answer some of your questions. My name is Dr. Frederick Unigboha. I'm a licensed medical doctor, and on this platform, we teach, we educate, we advise, but I beg you, we don't treat online. I don't treat online. I don't make diagnosis. If you have any medical condition or any medical challenge, I always advise you to please speak with your doctor. Now, every information will be given to you on this platform is evidence based, and you can take the comments anywhere and verify. I have my chief in the house. Good evening, sir. How are you doing? Good evening, good evening, good evening, sir. How you doing now? How's the family? I got your message. I responded to you, but there was no response. Happy Sunday to you. Joanne, hello. Good evening. How are you doing? So before we continue, tell me, where are you watching me from? Good evening. Hailing from Jos, Plateau State. Maureen, how are you now? How you day? Vincent, Lillian, Vincent, I see you. Okay, now I am the host of this program. We have been having this program for the past 5 years, and my co-host is Dr. Israel Irobonose. He'll be joining us very soon, and we'll be talking about peptic ulcer disease. But before we start, I want you to help me. Tell me, what do you know about, or what do you understand by peptic ulcer disease? Anywhere you turn to right now, you hear people saying, I have ulcer, I have ulcer. Help me, me and you. Let's discuss. What do you really understand by peptic ulcer disease? Oh yeah, tell me. What do you understand by that? Mr. Emmanuel is watching me on YouTube. Yes, I forgot to inform you. We are live on Facebook, we are live on YouTube, and we are also live on LinkedIn. So for the first time, I'm streaming live on my LinkedIn platform. So if you're watching me on YouTube, watching me on Facebook or LinkedIn, I would have added my X account and even my Instagram, but let's not do that today. So wherever you're watching me from, you're welcome. Yeah, okay, no problem. Yeah, good evening. Yes, no wahala. Okay, sir. And Jane, good evening from Enugu State. Mr. Smart. Mr. Smart is watching us from Delta State. Solomon Sunday is watching us from Oyo State. And then I have somebody watching us from Botswana. I think this is the first time I'm getting this comment. Mr. Joel, I'm a nurse. Hi, is Botswana. Okay, tell me, what do you understand by peptic ulcer disease? Don't Google. Oh. Hey, Obehi, I see you from UK. Obehi, how are you? I don't miss this program. Thank you. Oh yeah, now tell me, what do you understand by peptic ulcer disease? And if you're watching me on whatever platform, I need you to like and share. When you like, when you share, when you comment, you are telling the algorithm, you are telling the platform to show this video to more people. So that is how you support me. So let me see what you really understand by peptic ulcer disease. Hey, Madam Bleble, how are you? I see you. Obano, patients, I greet you specially. Will you answer me now? What do you understand by pep? You don't want to respond though. If I start now, you say this guy is not listening to me. Oh yeah, tell me. Chioma from UK. Okay, Chioma, I see you. How are you? Mr. James. I see you, Mr. James. Somebody says, please, sir, I want to contribute with something little for the data you are using. I don't know how to go about it, please. I'm so great. Don't worry, I'll tell you. Don't worry, I'll drop my account details. I will drop my account details. Don't worry. I'll tell you. I really appreciate Maureen. Huh? God bless you. Well, yeah, now see comments. Oh, everybody. Okay, let's start. Good. There's a comment here. Peptic ulcer could be said to be a sore in the stomach as a result of bacteria, Helicobacter pylori, prolonged use of NSAIDs or stress. I like this comment. Okay, good. Let's see if I have another one from about ulcer. Um, Mr. Jude, a medical radiographer. All healthcare professionals watching me, I greet you specially. You are all welcome. Eh? It is a disease of the GIT. Yes, you're correct. Make we no Google. No, don't Google. Don't Google. Tell me what you know about peptic ulcer disease. It affects only the stomach. Not really. Peptic ulcer disease does not affect the stomach only. Peptic ulcer disease affects the stomach. It can also affect the intestine, the first part of your intestine, what we call the duodenum. It can also affect your esophagus, the lower part of your esophagus. So, peptic ulcer disease can affect your esophagus, it can affect your stomach, it can also affect your intestine. That is the first part. Hmm? Okay, good. Let's see. I see you. Happy Sunday. Everybody share. Share. Jeremiah, special greetings to you. Let's see. Okay, no more. Okay. Now let's go. Now, peptic ulcer disease is, first of all, anytime you hear the word ulcer, please listen carefully. Anytime you hear the word ulcer, ulcer means a break, like an injury on any parts that contains epithelium. Please forgive me for using this word. So epithelium looks like your skin, inside of your mouth, anything that looks smooth around your body. Has epithelium, most times epithelium. So whenever you have an injury, whenever you have a break in that part of the epithelium, you have an ulcer. What this simply means is that you can have ulcer in your eyes. Yes, your eyes. Corneal ulcer. You can have ulcer in your mouth, inside your mouth. Aphthous ulcer. You can have ulcer on your skin. You can have ulcer inside your GIT and other parts of your body. Now, when the ulcer you have is inside your GIT, we call it peptic ulcer disease. When it's actually around the lower esophagus, the stomach, and the intestine. Are you together? Are you with me? Good. Now, the funny thing about it is that it's now very common. Anywhere you turn to, I have ulcer. Anywhere you turn to, I have ulcer. And then when you ask them, how did you arrive at the diagnosis? They will tell you, I did H. pylori. And they say I have H. pylori, so I have ulcer. Not true. Not true. I'm going to break it down for you. Now, let's see. So what causes ulcer? It's important you realize that anybody, a man, a woman, an elderly man, an elderly woman, a boy, a girl, anybody can develop ulcer. Anybody. But the funny thing about it is that research has shown that most times it's common with men for so many reasons. So what causes peptic ulcer disease? Please, I beg you, if you have ulcer, listen to me carefully. I will try and explain, I will try and respond to you, but I beg you, I won't treat you on social media. This place is not a hospital. You understand? I won't manage you here. I'm not your doctor, and I understand the implications of trying to manage you online. Is that okay? But I will try to advise you. Now, number one is that ulcer is caused by a bacteria. Very commonly, it is caused by Helicobacter pylori. The funny thing about this bacteria is that this bacteria can survive inside your stomach, and your stomach contains acid. But the acid in your stomach does not affect this bacteria. Are you with me? Now, this bacteria, what it does is that it releases certain chemicals. So these chemicals can gradually gradually destroy, gradually break down the lining, the wall of your stomach. But let me shock you right now. There are so many people with Helicobacter pylori and they don't have ulcer. Let me give you an example. By the grace of God, I don't have ulcer, right? If you test me for H. pylori, you might find out maybe I have H. pylori. There are so many people with H. pylori. You test them, it's positive, but they don't have ulcer. So because you are H. pylori positive, it's not 100% guaranteed. You can fact check me. Yeah. So you can confirm. But there are certain group of people, when they have the symptoms that look like ulcer, these people, when we test them, most times we discover they have H. pylori. Do you understand? Good. Another thing that can cause ulcer, um, this person says it is a disease that can be gotten from close contacts by an infected person. Not true. Not 100%. You are not correct. What's your name? Mr. Stanley. No. Mm-mm. Now, let me dwell more again on this. You see that bacteria, most times, the way you get the bacteria, you actually get this bacteria, number one, from childhood, most times, according to research. Number two, from poor sanitation. Number three, from poor preparation of your food. But because you have H. pylori and then I shake you, that does not mean you get it. Research has also shown that some people who have this H. pylori, when you engage in saliva exchange, when you rub your oral cavity together with somebody with H. pylori, along the line, you might pick the bacteria. Yes, research has shown. But saying that everybody who has H. pylori can transfer it to you, we need to create a balance. So that was why I said you are not 100% correct. Now, if you are with me, please comment. I can hear you and I'm following. Oh yeah, let's go quickly. Today we are talking about peptic ulcer disease. Ulcer. Don't ask me anything not related to ulcer. Quickly. So if you are with me, I'm with you. All these big names again. Don't worry now. I go break them down. Relax. Yes, H. pylori does not automatically mean ulcer. Now the fact be that waiting there one fact check again. The truth is that sometimes when we say things like this, Dr. Matthew, people think we don't have evidence or we are just speaking from our head, our feelings. We are not speaking from our feelings. We are speaking based on fact. And I'm happy that you have seconded, corroborated, supported what I just said. Okay, good. No, I can hear you and I'm following. Okay, good. I can hear you. Good. Now, the other thing that is notorious for causing ulcer, and I can bet out of the 120 something people watching me right now, about maybe 80 out of you listening to me, you have done this, and that is the use of pain relief, analgesic. So I'm going to write the name here so that you see. It's called NSAIDs. NSAIDs. And I'm going to give you example of NSAIDs. I'm typing the name so that I can put it on the screen and more. Okay. Now, NSAIDs. So, okay, this is my LinkedIn. This is my LinkedIn here. Okay, this is my LinkedIn. Wait, I'm coming. Okay. Yes. NSAIDs. Example of NSAIDs: diclofenac, ibuprofen, naproxen, piroxicam. What we notice over the years with research has shown that people who abuse this medication, they come down with ulcer. Any little thing, doctor. That was why I made that video and I was appealing to you. I did beg you. Say stop to the abuse pain relief. Don't just wake up and say, doctor, I have headache, I have body pain, and I'm taking this medication anyhow. You can give yourself problems. Do you understand? So I'm streaming live also on my LinkedIn profile. So if you're watching me from LinkedIn, you can see me. Facebook, you can see me. YouTube, you can see me as well. Good. Now, if you abuse this medication, you can come down. And then there are some other medications, like even steroids. There are people who take steroids and they can also come down with, they abuse steroids. They can come down with peptic ulcer disease. The other thing again is that there are some other medical conditions, though not rare, and I wouldn't want to bother you with those ones, but these are the common causes of peptic ulcer disease. Another one again that can increase your risk. There are certain things you do. Those things can put me and you at risk of developing ulcer. Number one is stress. Stress. There are different forms of stress. There are some kind of stress that are very severe. Some people who are involved in accidents, some people who are involved in fireborne, fireborne, um, road traffic accident, severe forms of head injury. You can go through a kind of stress that can lead and put you at risk of developing ulcer. Another one again is people who smoke. People who smoke, even alcohol, can put you at risk of developing ulcer. Now, if you have ulcer and you're watching me, please listen carefully. Ulcer is not a death sentence. I hate the fact that everybody right now, ulcer, doctor, my problem is ulcer. It's not a death sentence, I beg you. Because ulcer can be treated. But the funny thing is that you can have a symptom that looks like ulcer, but it might just be something else. You can have a symptom, listen carefully to me. You can have a symptom that looks like ulcer, and what you have is what something else looks like ulcer, but is not ulcer. And I'm going to list the symptoms now, so that if you have this symptom, does not mean you have ulcer until we can confirm that truly what you have is peptic ulcer disease. Number one, you can develop heartburn. Heartburn is not exclusive to ulcer. You can develop heartburn from reflux, even gallstone. You can have heartburn. This one, true life experience. You can notice bloating, like whenever you eat, you feel like bloated, like maybe there is gas in your stomach. Now, this heartburn, number one, in some cases, it looks as if there is pepper in your throat, in your chest. Whenever I eat this food, I feel peppery sensation. Oh, when I wake up in the middle of the night, I have this peppery sensation. When I'm hungry, I have this peppery sensation. Sometimes, because of the location, of your ulcer, you might also have this pain moving to your back. So the ulcer can be at the anterior wall of your stomach. In some people, it can be in the posterior wall. So depending on the location of your ulcer, not for everybody, you might also have that pain moving to the back, not for everybody. What other symptom again can you notice? You might notice you feel as if you want to vomit. Let me correct this. I got this question yesterday or 2 days ago. Somebody said, doctor, I have ulcer and I can feel it in my head. It's like it is moving in my head. I beg you, that is not ulcer. Ulcer does not move in your head. You can have ulcer and it might even, you might have the symptom that looks like ulcer and it might just be coming from your heart. So don't listen to me on this program and say, everything you mentioned, I have it and it's ulcer. That's my problem. No. We can only conclude after we have carried out the necessary investigation on you. Okay. Now, let me see. Is there any other thing that can cause heartburn, or it can only be ulcer? Okay, so Maureen, I have answered your question. Maureen. Do you understand? There are so many other things. Reflux disease, gastroesophageal reflux disease. You eat food, whatever you eat, somehow that food might just want to go back into your throat. Let me call it throat, your esophagus. So you feel the peppery sensation again inside your throat. Reflux disease, actually caused by a problem around the lower part of your esophagus. I am counting my words deliberately. I don't want to mention those big medical grammar so that you don't get discouraged. That's why I'm counting this word. The lower part of your esophagus. You might have a problem around that area. And then the food you eat might just go back inside there. Is that okay? So that is one of them. Then what again? Let me see. Let's see. I understand you perfectly. Okay, good. Now there are different types of ulcer. Quickly, I'm taking my time. Um, Before I start taking your questions, there are different types of ulcer, Mr. Man and Mr. Woman, with all sense of humility. And I appeal to you, if you are not a medical professional, if you're not a medical doctor, you can't conclude that I have gastric ulcer, I have duodenal ulcer, I have esophageal ulcer. You cannot. I'm not trying to make a mockery of you. You don't have the knowledge. Even if you read on Google, you don't. You understand? There are different types of ulcer: gastric ulcer, duodenal ulcer, esophageal ulcer. This name is based off of the location of your ulcer. So if your ulcer is at the lower part of your esophagus, if the ulcer is at the lower part, just before the food enters your stomach, that pipe before the food enters your stomach, that the lower part, if you have a problem there with ulcer, it can be esophageal ulcer. If your ulcer is in the wall of your stomach, the stomach, you can have what we call gastric ulcer. If your ulcer is not in the stomach, but in the intestine, the first part of your intestine, the duodenum, you have a duodenal ulcer. So if you have ulcer right now, the next question is, what type of ulcer do you even have? Are you aware or you are not aware? Have they informed you or did they not inform you? You didn't know? Okay, relax. So that is, but it's bigger than that. Now, how do we know that you have ulcer? Number one, you meet your doctor. Doctor, anytime I eat like this, I feel this feeling. Say, okay. This feeling, if I don't eat on time, it's very, very severe. Okay. Sometimes this pain, because of this pain, I'm scared to eat. I'm scared. I can't even eat. Okay. This thing has been happening to me for a long time. I didn't take it seriously. Okay. It's pointing. And doctor, the truth, I will not lie to you. The thing is that when I small, I used to live in one place. We used to eat anyhow. Okay. And then because of the kind of work I do, I usually take medications because of pain. My legs are always paining me, so I used to drink ibuprofen every time. Okay, I see. You have told us your story, your history. We will not tell you, young man, young woman, mommy, daddy, please lie down on the bed. Let's examine you. So what do? We examine your abdomen. Where are you feeling this pain? Doctor, this pain is usually around my chest. Okay. Why is it usually around the chest region? Because at that chest region, that is where your stomach, that is where your esophagus, and that part of the intestine, that is where they are located. That epigastric region, that part that is close to your chest. So if you tell me that I have ulcer and the ulcer is near my gbola, I have ulcer. The ulcer is near my becus. Oh baby, that's not ulcer. That's not peptic ulcer disease. Because most time, peptic ulcer disease, classical epigastric region. Then after exam, we will now tell you to carry out some tests. Number one, because of where we find ourselves. I know there are people who live, who reside, who work in the US, in the UK, in Germany, in France, in Italy, in the Netherlands, in Switzerland. You watch this live session right now. Your system is different compared to those of us who live in developing nations. For those of us who live in developing nations, it's not readily easy to afford the gold standard. It's not easy for us to pay for the test that can confidently tell us this is ulcer. So what we do is that we tell people, patients, to go and test for H. pylori first. Sometimes we can also check the poo-poo, your feces. Do you understand? We can check your poo-poo, we can check your feces. Yeah, what we call feces. Yeah. But the gold standard to make us know that what you have is peptic ulcer disease is called endoscopy. Hmm? Endoscopy. So I'm typing the name here. I'm typing the name so that endoscopy, so that you can see it on your screen. I'm going to Jennifer, how far now? Jenny, long time. Jenny, how are you? How are you? Okay. Yeah, so this is the name, endoscopy. Huh? Look at it. This is the gold standard. You can't tell me, listen, oh, look at me. You can't tell me that, doctor, I have ulcer. I went to test. They test H. pylori and then it is ulcer. We can 100% say you have ulcer if you have done an endoscopy. Most times, H. pylori is suggestive. It points towards ulcer. Do you understand? Eh? So that you don't wake up and say, I've been treating ulcer for 10 years old. I did H. pylori. They say it's ulcer. My dear, it might just be something else. Now, okay, I'm coming. I'm going to take your question. I'm going to take your comments. I'm coming, please. I want to be very fast. Yeah. Now, there's something that you did not know about ulcer. There is something that maybe you know, you didn't take it into heart, or you're not aware. And that is, some people can have the symptoms of ulcer and it might be stomach cancer. I repeat myself. You might have a symptom that looks like ulcer and it might just be stomach, what we call gastric cancer. It might give you every sign that looks like ulcer. Long time, doctor, I missed this beautiful family. I know now. It's been long I saw you. It's been long. So when I just saw your comment, I say, Jenny, it's been a long time. Oh. Now let me say something quickly. For those people that have been following me for a long time, for the people who comment on my videos, on my live sessions, I know them. I'm not bragging. So over the years, because I have been doing live sessions like this, I know my people. So when I see your name and it's been a long time, I'll be like, where have you been? So that is why I recognize that Jenny has been away for a long time. Jennifer, I hope you're good. Welcome back. Okay. It might even be a problem from the pancreas or the heart. Thank you, sir. Oh, thank you. I will buy you pure water. I will buy you pure water. Okay. This is why I beg you. Don't sit down at home and say, I have been treating ulcer, treating ulcer, treating ulcer. It might be from the pancreas, it might be from the heart, it might be from the gallbladder, or it might even be from stomach cancer. My people, I appeal to you. If you know you have been treating ulcer for a very long time and you haven't seen your doctor, I beg you, wherever you are, please speak with your doctor. You notice I don't tell you to speak with me. I'm not here for that. I just teach you and I move ahead. Please. So that we find out what is going on. Somebody says, Doctor, I don't fear. I am tired of visiting different hospitals. Why? Why? Tell me, Ogechi, what is the problem? Let's talk to you. Good evening, Doc. Hey, DJ. So much misinformation about this ulcer issue. Most Nigerians think it is lack of food that causes ulcer. Um, okay. Thank you, DJ. Not eating will not cause ulcer. Huh? Not eating will not cause you ulcer. But if you have ulcer, listen to me carefully. If you have ulcer and you don't eat, you will worsen your ulcer. Especially for the Christians and even some Muslims during the fasting period. You will notice that when you fast during the Christian fast or even the Muslim fast, we usually record emergencies, severe pain, severe ulcer pain because you are not eating. So you can trigger your ulcer. But if you don't eat, it will not give you ulcer. But if you have ulcer and you don't eat, oh my God, you go see shege. Now we build this family. Oh, yes, now, yes, now. I know you now, Mr. Godswill. Mr. Godswill, I greet you specially. Ambassador Joseph from Liberia, I salute you. I was diagnosed with ulcer and sepsis through endoscopy. Interesting. Okay. Ajayi Zainab, I see you. Let's see. Let's see. Uh, okay, let me see. I'm looking for comments. Sometimes it is worms, not even peptic ulcer disease. Thank God. I like your name, and thank God you said this. You're correct. God bless you. This information is timely. Where is Dr. Israel? Dr. Israel is supposed to join us. Oh, I don't know, but he's coming very soon. I think he's having network issues. It's not easy doing these live sessions. The data and the network is quite frustrating. Okay, now, when we now confirm that you have ulcer, there are some things we'll tell you. Number one, you can heal your ulcer, but it takes time. Ulcer can heal. Yes, Oriade crown. I like this. You're very correct. You're very, very correct. Yeah, you're very correct. Thank you. Ulcer can heal. It takes time. Now, let me paint a picture for you. If you have an injury on your face, let's say on this part of your face, and every day, this part that you have this injury, you begin to hit this part every day with your hand. When you go to bed, you hit that place. When you are walking on the road, they hit you in that spot. When you are talking with your friend, mistakenly, they hit you in that spot. When you are playing with your kids, they hit you at that spot. Will that injury heal? Answer me now. Hello, baby. Answer me. Will that injury heal? Oh, baby. Answer me now. Share this live session. Oh, yeah, share the live session. Oh, yeah, now. Will that injury heal? Hello. Hello, sir. Oh, yeah, now. Tell me. It will not heal. It will not heal. The more you keep hitting that particular location, you refuse to allow that injury rest. You continue to traumatize. Now, for some people that have ulcer, peptic ulcer disease, when we advise you, avoid this and this. Allow that region heal. Take your medications. Give it time. They say, no, I want the ulcer to heal immediately. No, it takes time. And the funny thing is that the moment, the moment you feel relief of your symptom, that does not mean the ulcer has totally healed. The moment you feel as if everything is fine, you go back to your ways of life. You can reactivate, you can trigger, you can, what do we call it word again? You can re-injure yourself. If that word does exist, I don't know if it does exist. Fruit challenge was one of our best fun time that brought us together all the time. Yes, I might resume the fruit challenge, ladies and gentlemen. I might resume the fruit challenge. I don't know. I'm still thinking about it. If I can get sponsors, I will resume our 1 month fruit challenge. Okay. My sister got healed from ulcer from fasting. How is that possible? Your sister got healed of ulcer from fasting. I'm trying not to make a mockery of your statement or deny your reality. But the truth is that it's almost impossible to have ulcer and you fast and it heals unless your sister never had ulcer. Listen. Unless your sister never had ulcer. Because if your sister had ulcer and your sister stayed away from food, oh my God. Hmm? Do you understand? Uh, so let's talk about the kind of food to eat and not to eat if you have ulcer. Number one, it's been advised that if you have ulcer, avoid number one, avoid drinks, caffeinated drinks, beverages, carbonated drinks. Avoid them. Avoid alcohol. Avoid foods that contain spices. Why? Because those spices in your food will trigger the release of acid, gastric acid. So when you eat these spices, they ensure that your body will keep on producing acid. So we advise you to limit the spices in your food. Reduce pepper for Africans that love eating pepper. Reduce pepper. And that thing again, you should try to take note of. Let me see. I'm coming, please. I'm coming, please. I'm checking for something. Wait, I'm coming. Okay. Now, they tell you to avoid eating fruits. So let's break it down. There are some people that have ulcer. Whenever they take oranges, they notice severe heartburn. There are some people that have ulcer. Whenever they take watermelon, they develop heartburn. There are some people that have ulcer. Whenever they take pineapple, they develop heartburn. Some other people that have ulcer, whenever they take tangerine, they develop heartburn. Now, these fruits I mentioned, almost all of them, they are in the citrus family. That is, they contain a very high level of vitamin C. So vitamin C, when your body acts on vitamin C, your body can convert that vitamin C again to acid when it's working on the vitamin C. So it triggers heartburn for them. But not everybody that has peptic ulcer disease would have heartburn with orange, with pineapple, with watermelon, tangerine, with which other fruit again? Not everybody. So what you need to do is, if you have ulcer, take note of the things you eat. You take a note. Some people have ulcer and they can't eat beans because beans causes heartburn for them. But there are some other group of individuals with ulcer. They have no problem. So this stuffs about what should I eat or what should I not eat is not cast in stone. It's not, you don't generalize it for everybody. You advise the patient and tell the patient, you yourself note what triggers your ulcer pain. Surprisingly, there are people that have ulcer, and when they drink Gary, you know Gary now, our African Gary, uh Gary can cause heartburn for them. Hmm? Also, yes, your fries. When you eat fries, fried food, fried what again? Fried plantain, yam, what again? Egg. Oh, your fries, chicken. They can also trigger your listen, what is that? Your what? Your heartburn. Okay. Now, okay, so we're talking about ulcer tonight, and let's see. Um, okay. Now, what are the foods that can help you? If you have ulcer, some fruits that you can eat. You can eat your banana. Banana can help you. Though banana also contains vitamin C, but not like the oranges and the rest. It can help you. What else can you eat? You can eat your. It's quite difficult. Um, this one, what to eat? The ones that you should not eat is better to advise. Yeah. Okay. Yes. Now, somebody this person said something. Alcohol, caffeine, spicy food, acidic food. Yes, tomatoes can irritate the lining and worsen ulcer pain. Correct. You're very right. Processed food. Correct. Processed food. Processed food. You're very correct. Okay. You're very correct, Mr. Crown. Now, what again about ulcer? So when you have ulcer, there are certain medications we give to you. Those medications, number one, if you have H. pylori, those medications are to help you treat and fight your H. pylori. Um, Please, have you shared this live session? I want to be sure that you are sharing the live session. Oh yeah, ladies and gentlemen, please share the live session. Hmm? If you have not shared this live session, I need you to do so. If you're watching me on YouTube, if you're watching me on YouTube, everybody watching me on YouTube, like this video, like the video, and please share. The more you like and share, the more you support this video so that more people can see the video. Okay. So there are medications we give to you. These medications are actually to help you manage, number one, the bacteria. Number two, to cover that area of your injury, to cover that particular area so that you don't you don't feel pain in that area. And then the medications in some cases can be taken for 1 month. In some cases, it can be taken for 2 months. Ulcer can heal. Ulcer can heal. Yes. Okay, let me see if I can take some questions. Is duodenal ulcer the one that pains my back? My own ulcer is my back that hurts me. Zainab, so we can confidently say if you have um, duodenal or gastric ulcer if you do an endoscopy. Hmm? If you carry out an endoscopy, most times na gastric ulcer because they radiate to the back. But we can't confidently say if it's gastric you have or duodenal unless you do an endoscopy. Okay. Let me see. Okay, so before I continue, I have a private community. Anytime I don't talk about my private community, the people on my private community, they are not happy with me. So let me tell you about it. Whenever they watch this live session, they'll be like, Dr. Fred, why are you not talking about your private community on Telegram? So I want to tell you about my private community. It is private, meaning that it's not open to everybody. You can only join when you subscribe. And when you join my private community, it is a community. It's not consultation. A community where people ask me questions, I respond to them. In that community, I go live in that community. And when I go live like this, I speak with you. I can speak with you during the live session. It's not a community for private chats. There are some people in that community, they have never one day commented, but every month they subscribe. So it is one other way to also support what we do on the internet. Don't be deceived by followers. Most of these followers and the views, they don't give money. So don't be deceived. Don't think that this thing I'm doing right now, I'm cashing out. Don't do that. If not by cash out, I'm not going to hear. So the private community is one way for you that wants to support me to join and subscribe. It's opportunity for you to also interact with me more. I can respond to your questions as many as you have in the live session in that community. And it's on Telegram, but you can only join when you subscribe. You can't join through Telegram. You can only join when you click on the link and subscribe. Okay, I have shared. More grace. Thank you, Mary. Mary, God bless you. What if the ulcer is not caused by H. pylori? Sarah, I mentioned it. H. pylori is one. There are other causes of ulcer. Analgesic, NSAIDs. Another one is, for some people, not common, Zollinger-Ellison syndrome. For some other people, stress-induced. For some other people, abuse of steroids can also cause that. Doctor, please respond to my question about chronic atrophic. So what is your question? Madam Roots, what's your question? I was diagnosed with chronic um I was diagnosed with chronic gastritis through endoscopy. Please, is it the same as ulcer? And will I ever get healed, sir? Please. What's be your name? Gift. Gift, calm down now. I don't like you putting all these crying pictures. Relax. Chronic gastritis is not the same as ulcer. Chronic gastritis might even be a sign of your ulcer healing. Chronic gastritis might just be you are the one making it chronic by doing something that is making it chronic. So maybe there are some things you are doing. That is why your gastritis. Hey, Jesus, how do I explain gastritis to you? Let me try. Let me try. Let me try, ladies and gentlemen. I need something. I need something. Okay. This, look at this, I beg. Look at this. This is open. Whenever you eat food, the food goes inside here. Hmm? So this is like your stomach, right? The food goes inside. So inside this place, inside your stomach, this is the wall of your stomach. This wall. There are some things you can do that can traumatize this wall, and it might not just be ulcer. One common example is that there are people who can eat very hot food. There are people who can drink alcohol, very all those harsh alcohol. It can traumatize this thing and cause inflammation. It will be very red, gastritis, inflammation of the gastric mucosa. Gastritis is what? Inflammation of the gastric mucosa, the lining of your stomach. That's gastritis. It can be acute or chronic. So if you are having chronic gastritis, it simply means that there is something that is making this gastritis there. Oh, baby, is that okay? So I don't think it's something you should be crying. I think it's something that you can just speak with your doctor. Please, doctor, how do I gift you? Drop your account number. Okay, I'm gonna do that. I'm gonna do that. I will drop my account number. Um, I'm gonna drop my account number. Okay, wait first. Before I drop my account number, let me take this question, then I'll do that. I asked the difference between atrophic I've answered. Okay, I've answered. Um, um, oh my God. Uh, I was diagnosed of, please, I was diagnosed of H. pylori, which was negative. How did they diagnose you of H. pylori and H. pylori is negative? I was diagnosed of H. pylori, which was negative. No, sir, or no, ma. It's not possible for anybody to diagnose you of H. pylori and then you are H. pylori negative. So the first part of your comment is off. Huh? You understand? You understand? Yeah. Okay. I'm going to pin my account number. But FOB, fecal occult blood, show positive. Do I have ulcer? There are many reasons why you can see blood in your stool. Ulcer is just one of them. There are so many reasons why you can see blood in your stool. I made a video about it, Mr. Mighty. Hmm? I made a video about it, and what did I say again? Yes. So you cannot be diagnosed of H. pylori and your H. pylori is negative and you were diagnosed of H. pylori. So something is wrong with that statement. In fecal occult blood showed positive. Do I have ulcer? I know I can't say yes to that. There are many things that can give you fecal occult blood. Huh? Sure you get. Okay. Um, is that some people know they listen. When you explain to them, they're not going to listen, but they want somebody else. Uh, okay. So I think I've answered you. Yes, yes, yes. Let me see. I'm looking for questions. I've answered your question, Madam Roots. I've answered your question. Um, is every heartburn From what one eats caused by ulcer? No. Joe Christie? No. Every heartburn from what you eat is not from ulcer. It might just be from even the food, or it might be from your esophagus. It might be a reflux disease. It's not from ulcer. Eh? Yes. Uh, okay. Okay, so I'm looking for your questions. Okay, I've answered you. Uh, Let me see. I've answered you right now. Okay, okay, good, 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 good. So no more questions, right? We have less than 10 minutes on the live session. Okay, oh, have I? Please reply. Reply what? Please reply. Sorry, the daddy in the house. Which? What's your name? Your name is Blessing. Blessing, you are just coming. I have explained now. Peptic ulcer is the generic name. Is the father of all of them. Gastric ulcer is one of or a type of peptic ulcer disease. Peptic ulcer disease is like Nigeria. Gastric ulcer is like a state in Nigeria. So peptic ulcer is the big name for all of them. So there is gastric ulcer, there is duodenal ulcer, there is esophageal ulcer. Do you understand? Okay, who be this one now? This one go just the you can talk nonsense. You people can sometimes you can talk nonsense. Are you not seeing me answering men? You can talk nonsense sometimes, you people. This person, only women you can answer. This nonsense thinking, is a messed up mentality. If you ask me any question not related to ulcer, I'm not going to respond to you. I'm not going to respond to you. I'm talking about peptic ulcer disease, and you are asking me about ovarian cysts. For God's sake, we are talking about peptic ulcer disease. And I'm trying to respond to everybody. Whether you are a man, you are a woman, I will respond to you. But if you ask me anything that is not related to our topic tonight, I won't respond so that you don't take us away from our topic. Haba. Ah. Um, uh, Whenever we are doing a question and answer session, you can ask us anything, we'll answer you. Question and answer. But today is not a question and answer session. Today is strictly for peptic ulcer disease. So any question that is not related to the topic of today, will not be answered now, so that you don't take us away from our topic. Now, finally, before I finish, I have a course. There are some of you on Facebook, on YouTube, on TikTok. Some of you want to do content creation. Some of you are already posting online. And some of you, your page is going down every day. I made a course. It's my course. I made the course, and the course will help you. The course will guide you. Guide for new content creators. If it will not help you, I will not talk about it. Waiting concern me. And for those that have gotten the course, they know the value. They can't regret it. So if you are watching me, you want to understand content creation. You want to know whether you can make money. You want to know what type of content to make. You want to know how to protect your page. You want to know how to set up your page. You want to understand so many things. Get the course. It will help you. I know put water for mouth, talk am. It will help you. But if you say there is no need, and then when you struggle and struggle and struggle, and then you suffer with your page, you're going to find who to help you. By that time, if you don't go far, if you hard. So instead of you suffering, whether you are a father, a mother, and you want to understand content creation, send this email. my admin will tell you how to get the course. It is very cheap. Okay. Yes. Okay. First timer. I greet you. What, Mr. Francis? I greet you. Peter, I'm having ulcer. The doctor told me. Is it good to take ulcer medicine all the time? Okay, so the answer is you cannot take ulcer medicine all through the year. It's not okay. It's not nice. It's not normal. You can take your ulcer medicine for a period of time, and the moment your ulcer heals, eh, you stop your medication now. But the thing is that there's some people, when they start the medication, they stop, they think they are fine, they traumatize their stomach or their intestine, the pain comes back, they go back to the medicine. But if you take your medications and you follow all the advice given to you, you would not need to take the medication for all your life. Yeah. I am a first timer. What's your name? Margaret. Margaret Mary. I see you. Welcome. Okay. Good evening. Just joining you now. Oh, you came late. So this live session holds every Sunday by 8 p.m. to 9 p.m. Nigerian time. And we have been here since 2020. Every Sunday since 2020. We have always been here, me and my co-hosts. 8 p.m. to 9 p.m., we are always online. So if you are just joining us, if you are just seeing us, you are welcome. We appreciate you spending your time here. We don't take your presence here for granted at all. But please, I beg you, if you have any medical challenge, any medical condition, do well to speak with your doctor. Social media is good. Social media will teach you. Social media will educate you. But I beg you, not everything on social media is safe. Not everything on the internet is safe. I say this without fear. I'm saying this not because I'm looking for your money. I'm saying this because I have family members who watch my live sessions too. I have friends and relatives that watch this live session, and I'm talking to them as well as I'm talking to you. Not everything on social media is safe. The best person for you is actually your doctor. In as much as I am a licensed medical doctor, I'm not going to put your life at risk because I want followers and I want you to like me. Waiting be that one. Waiting be that. License where I suffer collect. You understand? So I'm telling you the facts, and I know the fear to come. So please, social media is good, it's nice to educate you, but not everything on social media is safe. Huh? Can you please drop next week topic? I'm a final year student nurse. So I'm going to do this for you. What topic do you want us to talk about? Tell me, what topic do you want to talk about next? Tell me. God bless you, doctor, for the good teaching. Good evening, sir. First timer. Blessing. I love your name. Blessing and good luck. So I receive blessing and I receive good luck. Thank God I greet you specially. First timers, plenty for here. Okay, let me use the next few minutes to appreciate the first timers. Onyi, baby. I see you. You're welcome. My mom is having pain in her back. Is it ulcer or cholesterol? No, it's not ulcer. It's not cholesterol. I can't say what it is, but most likely it might be age related. It might be due to her spine, maybe her age. So it's not about ulcer. I can't say your mother has ulcer. I can't say it's cholesterol. Yes, she might have cholesterol. She might have ulcer, but it might not be the cause of her back pain. It might just be due to her age or something else. Philomena, I greet you specially. Like your program. Well done. Now, I have over 120 people watching me here. Thank you. Thank you. I'm starting nursing school. Please, I have problem by the anatomy. I wish I can help you, honestly. But I can't teach anatomy online. Nobody will watch. I swear. I wish I could. I swear, I wish I could, but nobody. They will abandon me. and it will affect my page negatively. So go to YouTube. There are some pages on YouTube that teach anatomy. Just watch all their videos. I swear you will understand. No vex. I wish you all the best. Temitope, you're welcome. Favor, you're welcome. Patience, you're welcome. Christiana, I've missed a lot. This program has been on since 2020. I am new here. Yes, yes, yes. You're welcome. Okay. Can you talk about any condition under nervous system? Okay. Any condition under the nervous system. I will discuss with Dr. Israel, my co-host, and we'll look for one topic. Common topic that will help the public and that might also come out in exams. So one condition that affects the nervous system, maybe stroke. We have spoken about stroke before. We might talk about it, but I'll tell him. We'll look into that and then I will let you know. Thank you everybody for your time. Thank you for watching. Thank you so much. What do I want to say again? Yes, if you haven't gotten my course, please do well to get the course. It's very cheap. It's 10,000 video course. You will never regret. And if you want to join my community on Telegram, there's a link on my page. Subscribe and join. Like I always tell you, it clear, I be no clear. It clear, I be no clear. It clear, Abi. Remember, good life now waiting. Good life, Tessie. Good life. Nah sense. Take care and have a wonderful evening. Bye bye.